Hello ladies and gentlemen, this video is recorded to fulfill the requirements of the first virtual national forum, the implication of the COVID-19 pandemic on the adoption of information technology in Algeria. I am privileged to represent my study titled Tracking COVID-19 in Algeria, an Ethical Stand. Algeria, as the rest of the world countries, had great challenges facing the COVID-19 pandemic, especially due to the vulnerability of its health and economic system and the disturbing political situations. Many of the countries turned out technology to facilitate what was once an ordinary individual actions towards e-learning, distance working, establishing formal meetings, online services, tracking the location of those infected with the virus, and monitoring, which also matched by many ethical and responsible practices, opening university websites, databases, and laboratories for scientific research and learning free of charge. Our main question is, what is the ethical stand of tracking COVID-19 in Algeria? Our sub-questions are, what are the ethical issues presented in the medical and economic domain in the country? How did the technology contributed to the resolution of these issues? What are the pitfalls that have accompanied the tracking of COVID-19 in the country? These questions will be answered at the end of the study. To describe and track the stages of the spread of COVID-19 in Algeria, the study relied on both direct and indirect sources of information: literature reviews, medical journals, data and reports, magazines, quantitative and qualitative studies, specialized statistical websites, and electronic newspapers. Digital public health tools. There are four types of COVID digital apps used during the pandemic: proximity and contact tracing, symptoms checkers, quarantine compliance tools, flow modeling tools. Studies conducted in countries like the US, Switzerland, and Italy during April and May 2020 shows that only between 55 and 70% of adults of all ages were willing to download a contact tracing app. This results even in countries where privacy safeguard are in its highest. It is estimated that digital proximity tracking is only effective for contact identification. Technology should be adopted by 60% to 75% by the country's population. The effectiveness of this process required sufficient technological infrastructure and ethical use insurance. Globally, 51% of population does not have even internet access. This part shows foreign countries' statistics, numbers and percentages of population were willing to download tracing applications. Scientific research ethics under the pandemic. One of the controversial examples of abusing scientific research for either scientific record or economic purposes was the retracted Lancet study, which claimed that the use of the anti-malarial drug hydroxychloroquine was of no benefit to curb COVID-19. Drugs trial, vaccination, and immunity passports. On April 24, 2020, the World Health Organization stated a global collaboration to accelerate the development, production, and equitable access to new, safe, quality, effective, and affordable COVID-19 diagnostics, therapeutic, and vaccines, declaring collaboration of humanitarian organizations and private sector organizations. Trials on COVID-19 drugs were also placed of bioethic violations, especially in the existence of a huge gap between conducting expeditiously clinical studies and drug effectiveness and safety, and rushing into trials in COVID-19 patients without a plausible hypothesis and appropriate evidence of safety. Chile, Germany, and UK suggested the use of immunity passports, certificates, license, which is document confirms that an individual has been infected and is immune to COVID-19. Ethical concerns of using immunity passports are that such an immunity program could lead to unequal treatment to individuals based on ethnic, religious, socio-economic status consideration, and other discrimination characteristics. Medical ethics under COVID-19 pandemic. In a severe respiratory as a public health emergency illness, incline the ethical aspect in a rational manner of benefit maximization, equality treatment, promoting the instrumental value, and the worst off goes first. Six specific recommendation for allocating medical resources is considered. Allocating resources are not for first coming. Maximization of benefits versus minimization of harm. Identification of the research participants so in the future they benefit from any cure or vaccination. Health workers first in allocating limited resources. All principles apply to everyone. Responsiveness to the evidence in testing, intervention, and vaccination. Basically, there is a switch from a patient and duty of care basis towards promoting persons' equality and equity. Many events happened in Algeria since the first case was recorded. It was the second injury recorded in the whole of African continent. A letter from the Secretary General of International Civil Aviation Organization in Montreal clarified the measures taken to limit the spread of infection by air transport, which are aimed to protecting the health of air travelers and airline workers. At the Algerian embassy, a special cell was designated for the deportation of students and travelers abroad. Turkish authorities have seized passports of Algerian travelers stranded at Istanbul airport and transferred them to shelters. The 740 Algerians in Turkey returned on board of three flights by Algerian Airlines on April the 5th. Algeria announced that it will evacuate all its citizens stranded. According to Algerian Prime Minister, who called Algerians to register their statements on the official website of the Prime Ministry and the Ministries of Foreign Affairs and Interior. April the 23rd set as the deadline of registration on the website. Conditions imposed such as passing the virus test within 72 hours before the date of the flight, in addition to possessing a ticket for the Algerian air flight caused a major problem to some students abroad in Russia and Italy, for example, especially for students who don't have tickets or whom their ticket expired prior to the evacuation announcements. According to them, they are struggling psychologically and financially. The national airline has scheduled 24 flights from December 4th to 19th from 7 countries to evacuate Algerians stranded abroad. National events. Because of the political movement started in 2019, people continued to go out to the manifestation despite threats. The movement was not suspended until March 17th. A total lockdown for 10 days closed Blida province, the first and the most affected areas. On April 20th, the Algerian Minister of Health announced that the country's health sector has lost 18 medical personnel. The trust crisis with government officials, official media, and even medical and disease treatment specialists' statements about the political, economic, or social and health condition led to the emergence of charlatans and non-specialized opinions, promises of alternative solutions. On March 21st, the delegate ministry in charge of emerging institutions announced the development of an official phone application with the aim of combating and limiting the outbreak. The president and general director of Algeria Telecom stated also that they succeed in developing an application and a website. News reported the designing of a national digital platform of health systems to monitor the numbers of infected people on April 14th. Scientific research also was present during the COVID-19 pandemic, despite its humbling ways. Finally, the production of chloroquine drug by the General Complex for Pharmaceutical Industries, (CIDAR). Local events. The first breach of patients' personal information was in the University Hospital of Constantine when a worker released an internal document on Facebook of the names and home locations of about 6 patients who were confirmed positive to the COVID-19 infection. After a few days, the man responsible presented to trial, punishing him for the act. Benevolent and civil society organizations tried to help by manufacturing masks and some prevention tools for health workers and people, raising food for families in a vulnerable socioeconomic status. Some of the professors and students affiliated with our university at Hamid Mary Constantine II raised a large amount of money to equip the local university hospital with ventilators, ICU beds, and sanitizers and other preventive equipment. A turbulent ethical stand tracking COVID-19 in Algeria. Many ethical principles were absent, and a few of them were applied poorly, which caused ethical issues and concerns in both medical and economic domain. In the medical domain, a general lack of ethical obligation of preparing the healthcare institutions and medical staff and workers to deal with crisis, the absence of an acceptable and homogeneous digital infrastructure, and neglecting the importance of ethical charters, codes, and guidelines. On the economic domain, the failure of full and partial lockdown strategy, the ineffective communication of authority officials, the failure to develop electronic payment, the shortage of internet cracks that affected communication, the absence of civil society institutions dealing with small and medium enterprises problems and concerns, lack of appreciation to the work of medical staff. The technology of information and communication in the medical field didn't contribute to the resolution of ethical issues. It caused them because of its absence. Only if taken into consideration the educational and entertainment purposes used during the pandemic. Social media, on the other hand, played a double role. A positive role concerning the involvement of the elites, medicines, experts, and public officials, communicating with the general public to effectively outreach and sensitize of the risk of spreading infection, explaining treatment protocols and method of prevention, etc. The negative one is spreading false news and mass exaggeration by population sometimes and panic among individuals. Ethical principles such as benefits and harms were not at its highest. Privacy is not of a discussion. Algeria had its law to protect personal information and digital privacy, but there is a general ignorance in society about what privacy means and what they should and shouldn't publish on social media. Liberty and autonomy. Due to the inconsistency of lockdown, its long duration that related to the changing number of infections, wasn't a good strategy to assure people financially, socially, and psychologically. Minimizing errors, the different tools of diagnosis, such as PCR, and the lack of tests specialized for the coronavirus, the centralization of infected samples of analysis in one center lab raised the margin of error in diagnosing the infected cases. Accountability. It is based on error and harsh punishment. It is important to take into consideration what is called the spirit of the law, understanding the deeper meaning and reason of law, even if it isn't written, as in letter of the law. Responsiveness to the evidence. In the testing and diagnosis stages wasn't at their highest. There are no guidelines concerning the priority categories to the ones benefiting from testing in general. In intervention, it was a complete medical decision, while in vaccination, it appeared that the priority defined by authorities were conformed to the international ethical guidance. Transparency and reliability were very low. It is only when talked about quick resolution, such as the drugs production and vaccination, which proven some severeness in managing the crisis. Fairness in the allocation of limited resources varied from different stages. Number of tests, prevention tools and clothes, masks, hand sanitizers, and cleaning products were distributed where it was the highest harm by infections caused, such as in the case of Lida province. Solidarity, on the other hand, was strongly present and of great impact at both national and local levels, from individuals, private and public institutions, charities, volunteers, and benevolence. With the emergence of the new British mutation of the coronavirus, concurrent with the sharp liquidity crisis continues in some cities, the spread of infection will make crowds vulnerable to reinfection is expected, especially under the low rate of the vaccination campaign.